Great. So welcome everyone to week 9, the first lecture of this week. So much to say about this week's lectures. This topic is very close to the type of stuff that I mostly do my research around. So I'm particularly passionate about this week's lectures. Hopefully you guys find it interesting. And really, it does build on a lot of the things that we've been talking about over the last few weeks, things like social determinants of health. Well, you could think of this week's topic as more the psychological determinants of health. And so we'll kind of unpack that and how health psychology, behavior change is really a huge part of public health and health geography as well. So welcome. Now I want to ask you guys, do you think people have a choice in the outcome of their health? Can they control it? Is their health something that people can control? What do you guys think about that? So Madison says to an extent. Amber says depends. Sarah says certain aspects. Reed says not always. Societal factors play a large role in health outcomes. Yes, I think most of you are kind of saying, yeah, sort of, maybe a little bit, depends. So yeah, you guys are on the right track there. How people act, how they think, how they feel, all of these sorts of social factors as well, they all contribute significantly to physical and mental health. And health psychology is certainly tied into that, how people decide to take an action, what their decision making is. So that's sort of the focus for today's lecture. Still got a few people in the waiting room here. So guys, remember to try to be here on time just so we can get everyone in before we get started. So health psychology. Well, health psychology is a branch of psychology that deals with individual behaviors and lifestyles, those that, of course, affect one's health. And it does share some common goals with health promotion, which is a separate sort of field of public health that really has to do with promoting people's health, giving them tools to exercise control or agency over improving their health, developing programs or policies to help people ameliorate their health. But this idea of psychology being a part of health, that's a little bit new. Historically, there were very few psychologists that were involved with something like medicine. So it wasn't really until more so the 1970s that psychologists began to realize just how much people's behaviors and their lifestyles had an impact on their health. And so, building on that, it sort of did become this much bigger field, especially as a part of public health, as a part of health geography, and how people's decision-making is certainly impacted by their social, their environmental, as well as other factors. And all of that goes into their behavior. So what is the specific link here between something like medicine and public health? Well, remember that medicine is all about diagnosing and treating individual patients, treating their disease or illness. And so health psychology is relevant to this because remember that people's behaviors impact a doctor's ability to diagnose or treat individuals. So what do I mean by that? Well, take for an example that not everyone chooses to visit a doctor regularly for something like an annual test or a checkup. Again, not everyone chooses the same treatment plans. So if a doctor offers them many options, let's say for something like diabetes, maybe they'll offer them a few different diet options to control their diabetes symptoms. Not everyone will choose the same one. So again, there's a lot of sort of decision-making that goes behind people's medical decisions, certainly. What about public health? Well, public health, in contrast to medicine, has more to do with preventing disease, especially in populations. And so people's behaviors impact their acceptance of certain public health interventions, which try to prevent disease in populations. So for example, not everyone chooses to eat 5 portions of fruits and vegetables daily, even though most of us know that we should. Not everyone chooses to exercise regularly, again, even though most of us know that we should. And certainly in the context of COVID, not everyone chooses to obey all the rules, and things like masking in certain places. There's a lot of individual decision making that goes into that can certainly impact population health as well as individual health. So what are these health behaviors that we've been talking about? Well, you can think of them mostly in two forms. So there's the health promoting behaviors, and then there's the health harming behaviors. Now, health promoting behaviors can also be broken down into two kind of related but different types. So there's health enhancing, health promoting behaviors. And those are really, if you think about something like maintaining a baseline level of health, so healthy people who just want to maintain their health, make sure that they don't develop disease later on. So things like exercise, healthy eating, taking vitamins, those are all decisions that people make to really enhance their health. In contrast, health protective behaviors, those might not be from sort of a baseline desire to maintain health, but more so spurred on by certain diseases that people want to avoid. So they want to protect themselves from a certain illness, let's say. So they might decide to use something like a condom. They might decide to go for a pap test. They might decide to go for a vaccine because it's a much more sort of targeted decision that they're making, usually in relation to a specific disease. Now, health harming behaviors, as you can imagine, is kind of the opposite of all of those. So behaviors that would harm health, things like smoking, things like binge drinking, something like not wearing a condom. So really the opposite of a lot of those health promoting behaviors. Now, there are two sort of motivators underlying these health promoting behaviors. So one of them is health directed, and that just means that it's really motivated by someone's diagnosis of a disease. So let's say they get diagnosed with heart disease, and therefore they make certain decisions because they are now aware of this disease diagnosis and they want to actively maintain their health or better their health specifically with that disease in mind. On the other hand, there's these preventive health behaviors. So that is just really motivating people to prevent any sort of disease later on. And that's really going to be the focus of today's lecture. Health-directed behaviors, those behaviors that are related to illness, are going to be something that we more so touch on in a couple of weeks when we talk about access to healthcare and why people might go for treatment of an illness in certain circumstances. So we'll leave that for a couple of weeks from now. But so today's main focus is really the decision-making behind preventive health behaviors. So how much do these health behaviors matter? What proportion of deaths are due to health harming behaviors? Why are these potentially so important? Well, as you might guess, it does depend on the health behavior as well as the outcome. So let's take a look at this. So this is from a burden of disease study, and it is looking at the deaths attributable to health harming behaviors. So remember, those were things like smoking, poor diet, those types of health harming behaviors. Now, what I want you to notice, so the dark portions of each disease are the ones that are attributable to behaviors, and the light portions are the proportion of deaths that are attributable to other factors, so not related to behaviors. And something that you'll notice is that for many diseases, the ratio of the dark to light is quite different. So for example, with heart disease and lung cancer, more than half are attributable to health harming behaviors. So more than half of the deaths of those diseases are related to people's decisions, their behaviors. On the other hand, something like HIV is almost 100% related to people's health harming behaviors. So again, maybe that's a little bit obvious. HIV is predominantly caused by the spread of an STI, which could be prevented with condom use. And so the vast majority of deaths attributable to HIV are said to be prevented from this perspective. Arguably, you could say that some cases of HIV unfortunately can't be avoided, especially if people unknowingly pass it on, but that's kind of a whole other discussion we could have. So sort of the main takeaway from a figure like this is really just to notice that not every disease is attributable to those behaviors, but many of them do have significant attributable deaths or attributable risk related to particular behaviors that people have. So let's take a look at some of these factors that actually influence health behaviors. The first is demographic factors. And so we've spent quite a bit of time talking about factors like this. Hopefully, we all kind of know what they mean. Perhaps unsurprisingly, income and education would obviously factor into people's decision making. The wealthier, the better educated you are, the more likely you are to make decisions that would promote your health. So whether that's because you can afford healthier, nutritious food, maybe you have the income to have a gym membership, for example. So obviously those types of factors would become quite important. Now, something that's, I think, interesting is those demographic factors that change. So particularly something like marital status. Someone might not be married forever. Certainly that is a demographic factor that could change quite rapidly in the span of, a couple of years. And so I found this interesting study that followed men over the course of 4 years. And so they tracked which of them stayed married, which of them became divorced, which of them became widowed, so on and so forth. And they wanted to track what kind of changes in their health behaviors would happen. So what did they find? Well, compared to the ones that stayed married, the men who became divorced, as well as those who became widowed, had a significant increase in their alcohol consumption. So another health harming behavior. If we take a look at some of these health promoting behaviors, those that became divorced, oops, we're still getting some people in here. Okay, hopefully we're all in now. So men who divorced and those who divorced but remarried had significantly less physical exercise. So that's the METs here per week. And of course, it did also have impacts on their BMI. So what does it say? Well, that the loss of marital status, marital relationship, had a big impact on the health behaviors of men. It also had impacts on their vegetable intake. Notably, it decreased their vegetable intake if they became divorced or widowed. But on the other hand, I decided to look for some studies that may have looked into females, because this particular study was based on men. And I was interested to find that the relationships were in many ways the opposite. So unlike men who tend to become unhealthier after the loss of marital status, right? They make certain decisions, certain behaviors that would be health harming. In contrast to that, women who became divorced or widowed tended to see improvements to their health. So what I mean by that is that they had certain health behaviors related to diet and exercise, for example, that seemed to improve after the loss of a marital relationship. So this just goes to highlight that the loss of marital relationships or any demographic factor that changes could really impact health behaviors differently for different genders, for men or for women. So it's something to keep in mind, the nuance behind many of these demographic factors. Now, the second factor influencing health behaviors is related to biological factors. And so many of these factors, in contrast to what we were talking about on the previous slide with gender, biological factors are not socially constructed. Of course, we are born with them. And so something like biological sex would have impacts on your health behaviors because of the differences in the sex hormones and how hormones might play a role in certain behaviors that people make. So for example, sex hormones do tend to regulate the production of certain hormones in the body, and those hormones in the body tend to have impacts on neurotransmitters. These neurotransmitters are those that initiate certain health behaviors in people. So for example, this one study was looking at the role of sex hormones, particularly in people who have periods, so during menstruation. And they found that sex hormones do play a really large role in regulating appetite and eating behaviors. And so what they found specifically was that progesterone, which is a hormone that increases just before someone has their period, that is what tends to increase food intake right before the start of the menstrual period. And so there are certain reasons why people who have periods do tend to get hungrier just before their period. There really is this link between sex hormones as well as the decision-making or the behaviors biologically that are linked to those hormones, such as eating patterns. Now, further, scientists do think that hormones may actually regulate some behaviors related to eating disorders. For example, androgens may promote something like bulimia by stimulating appetite and reducing impulse control. So these sex hormones do certainly play a role in regulating many of those behaviors that people make, particularly related to eating, but as well as other behaviors. Now, another factor influencing health behaviors are these social factors. So I think many of you kind of clued into that one. Now, we're not just talking about something like family or peer influence, although certainly those are important. Many of these social factors do also result in some positive behavior change, so they're not always negative. For example, our social environment can sometimes reinforce our disposition towards executing certain behaviors. Think about any time a friend has dragged you to the gym when you didn't really feel like it, or dragged you to an exercise class, or maybe even if you're going out to eat with a group of vegetarians, that might influence your eating patterns because of the social environment that you're around. You're much more likely, obviously, to go with them to a restaurant that they are choosing if you're kind of the odd one out in relation to their diet. And so these social factors do play a really important role in regulating these health behaviors. Now, another factor would be cultural factors. So some ethnicities, of course, do have certain traditions or certain customs with practicing certain traditions. Many of these are related to certain health behaviors. Just as an example, tobacco use was used for many, many years by Indigenous peoples. In fact, it was a very important part of many of their ceremonies, their offerings. It was often used as medicine. And so there's really a long history of tobacco use, which many of us in public health would classify as a health harming behavior. But for some ethnicities, it is a really important part of their tradition, a part of their customs. And so any interventions that someone in public health might want to design, something maybe to reduce the prevalence of smoking, that would have to be really done carefully in a culturally sensitive way, particularly among some historical groups. So there's always something to keep in mind anytime you're trying to change certain health behaviors, that you do have to go about it in a more sensitive way. Also worth noting, religion, of course, is a pretty important cultural factor that does certainly have an impact on people's health behaviors, specifically related to certain harming behaviors such as alcohol use, as well as sexual activity. So certain religions do tend to, regulate alcohol use and really promote sexual abstinence, for example. So this was an interesting study I found that was looking in the US specifically. So they mapped out different rates of excessive drinking in different areas of the US, and they also decided to look at tweeting. So they looked at specifically drunk tweets. And what they found was that certain areas in the US that are predominantly enclaves with Latter-day Saints, so Mormons, as well as areas with a large evangelical population, so Christian, they found that the rates of excessive drinking were obviously among the lowest, but also interestingly that they didn't tweet as much about getting drunk. So that was sort of another way for them to hypothesize whether or not drinking was taking place in certain areas of the states based on that. Now, another factor is personality traits. And so, of course, personality traits might play a role in influencing people's health behaviors, although it's somewhat a way of simplifying people, which isn't always easy to use. What I mean by that is that if you choose a selection of traits that people have and try to characterize their personality based on those traits, it can become problematic because, of course, people change. Their personality isn't necessarily static. And of course, many biological, social, cultural factors shape our individual personalities. And those are also things that can sometimes change. So the literature on personality traits and health behavior change is a little bit less strong, I would say, than some of those other factors that we were looking at. But in any case, personality traits can indicate some likelihood of certain health behaviors, and particularly ones around substance use and abuse. So this was a study that was looking at alcohol use specifically, and alcohol abuse. And what they found was that certain personality traits, specifically those linked to high extroversion, low conscientiousness, as well as anxiety. So those were really ones that played an important role in terms of predicting alcohol problems later on in life. So there are certain personality traits that can be linked to certain health harming behaviors. Now, the last factor I want to talk about is related to health media and marketing. Perhaps unsurprisingly, we take a lot of cues from trusted individuals, whether that's experts that we perceive. Certainly doctors are people that many of us would trust when it comes to health decisions or health promotions, health policies. And yet it's interesting to reflect on the role that doctors maybe played in the past when it came to certain health products that were being marketed. So not that long ago, cigarettes were seen as something that could be beneficial for your health. In fact, many advertisements called them doctor recommended and really pushed them as a product that could ease people's stress, lower their anxiety, even help them lose weight. And of course, the health harms really began to emerge after that. And luckily, people have really changed their behavior when it comes to something like cigarette smoking. But we did take a lot of those cues from a lot of those experts that were originally touting cigarettes as these great, great products that everybody should be buying and taking part in. This shouldn't come as a surprise now, I think, given the role that a lot of celebrities play in influencing norms, pushing certain health products into our domains and what we kind of interact with, especially on social media. And so a lot of these sort of celebrities do tend to influence a lot of health behaviors. They can really influence people buying certain products, people partaking in certain activities that they increasingly view as normal or desirable in order to maybe have a certain lifestyle that is related to the lifestyle of those celebrities. So certainly the media and marketing do play a really big role in health behaviors. Now, out of those factors that we looked at, so there were 6 sort of main ones that we looked at: demographic, biological, social, cultural, personality, and media. Which one of these factors do you guys think is modifiable? So what I mean by that is, which ones are modifiable factors that could actually be changed in order to change a behavior? What do you guys think? So Sunima says personality, social influence, Fiona. Social factors, personality, social. Health media is the most important. Okay. Social media, maybe cultural. Are there any that are absolutely not modifiable that you would say are things that people cannot change? Biological. Yeah, exactly. So biological is probably the only one that's kind of the most difficult to change out of that list. Certainly demographic is kind of an iffy one. You can change certain circumstances like income, of course, but often the circumstances that you're born in do continue to play a role in your life course. Certainly your behaviors would be tied into that. So yeah. Now, the reason I bring this up is because a huge part of health psychology, health behavior change, this whole kind of field of research is really figuring out, well, how can we actually change people's behaviors? How do we make them make healthier decisions? How do we sort of help them come to those decisions? So there's 3 different models that I'm going to talk about now. And these 3 models really just kind of help provide us with a framework for how you might approach some kind of public health problem. Let's say you wanted to help people make a certain decision. You wanted to try to figure out what are those important factors that really could help someone come to that decision. So the first behavior change model that we're going to talk about is the health belief model. So the health belief model really just summarizes 6 variables that tend to be really influential on someone's health beliefs And according to the health belief model, it's those beliefs that are really, really important at whether or not someone will change their behavior or perform some kind of action. Are these being used right now to convince anyone doubting the vaccine? Yes, absolutely. Certainly in public health, this is kind of the main question. And tomorrow we'll actually talk about vaccine hesitancy. So if you are interested at all in that, definitely tune into tomorrow's lecture. That's a great question though. And so back to this particular model. Let's say that you wanted people to use contraception, right? Let's say that is the action that you were hoping to get certain population to really consider taking. So according to the health belief model, there would be 6 sort of factors that you would want to consider and maybe study in order to try to understand what influences people to use something like contraceptive. So the first one is perceived susceptibility. Let's think about it from this perspective. If you're in a relationship and you're sexually active, perhaps your perceived susceptibility of getting pregnant or getting a partner pregnant would be high. And so that susceptibility might influence you to use contraception. The second factor, perceived severity. Let's say you're not in a position financially to support a child. Maybe you're not in the life stage. And so, the perceived severity of that inaction, so of getting pregnant, let's say in this example, perhaps that has a really high cost, a really severe consequence. And so that would influence you to use contraception. The third one, health motivation. Let's say if you were a female considering birth control, maybe the fact that the birth control pill could help with acne is something as a really big health motivator for you. Let's say if you were a male who was considering whether or not to use a condom, maybe the fact that condoms also protect against STIs is a really strong health motivator, and that would influence you to use contraception. So that's an example of that. The fourth one is perceived benefits. Now, perceived benefits is really how you perceive those benefits over any consequences. So going back to the example of birth control pill, let's say for a female, the benefits of the pill would outweigh any consequences of, let's say, developing a blood clot. So someone would kind of make their own cost benefit analysis, and they would decide, okay, the perceived benefits to me are probably higher than any costs, and therefore I will use contraception. So that's how that fourth factor comes into play. The fifth one is perceived barriers. And so perhaps quite obviously, any barriers like costs would certainly impact someone's decision to use certain contraception. And this definitely plays out with something like IUDs. So there's 2 sort of main types of IUDs. There's the copper IUD and the hormonal IUD. And anyone that has ever looked into this knows that the copper IUD is significantly less costly, and the hormonal one does cost quite a bit more. And so that might also influence someone's decision of whether or not to use certain contraception or maybe to abstain from using any. Now, the last one is cues to action. So this is an interesting one because according to the health belief model, our beliefs can be changed by certain events, certain cues that we take from around us. So this might be something like an educational campaign. Let's say you passed by a billboard that was talking about pregnancy. So maybe that would sort of spur you to make a decision about contraceptive use. But also cues to action could include something like a personal experience. Let's say a friend of yours had an unwanted pregnancy and you kind of saw them go through that. So maybe that would kind of influence your decision-making about whether or not to use contraceptives. So those are sort of those cues to action, those really important events that might influence your decision-making of whether or not to take a certain action. So that's the health belief model, essentially kind of an easy way to understand those 6 factors that might influence or might impact someone's decision-making with respect to a certain decision or behavior or action that they might take. Now, the next one, the next behavior change model is called the protection motivation theory. So what this means is that essentially an individual, anytime they're making some sort of decision, is going to appraise a threat. So what does this mean? They're going to decide how vulnerable they are to the threat. They're going to decide how severe the threat is, as well as any potential costs or rewards associated with that threat. So in particular, this kind of theory says that if someone believes that a threat is severe enough, then they might actually take that action. They might make a decision because they believe that that threat is so severe. And this is carefully balanced with how someone believes that they can cope with the threat. And so this is this idea of self-efficacy. So self-efficacy just means an individual believes that they have the ability to take an action, to execute a behavior successfully. So that's really that health protection motivation. It's two aspects of it. So they're appraising a threat. They're trying to decide how severe a threat might be to them, balanced with the coping appraisal. So how well a person can cope with that, to what extent they believe that they have the ability to execute a behavior or take action successfully. Now, this type of theory isn't only applied to health. It's also applied to things like environmental decision-making. So certainly in this example, you can see that they used it to understand people's decision-making about electric vehicle adoption. And so in this example, someone might be thinking about the vulnerability of the environment, the energy sector. They might be thinking about the severity of something like climate change, but they'll also be thinking about their ability to actually buy an electric vehicle in this example. So they might certainly think about something like costs and how that would influence their self-efficacy. So how that would influence their ability to actually go out and buy an electric vehicle. So that's just an example of how this particular behavior change model can also be applied to things outside of health. Now, the last main sort of behavior change model that we'll talk about is social cognitive theory. So social cognitive theory is interesting because it really emphasizes the changes in behaviors that happen specifically from our environment. So what that means is how we observe other people and how we interact with our environment. So social cognitive theory thinks that those are kind of the main important aspects of people's decision-making and their behaviors about health, specifically because, as we observe our environment or people around us, that is really what impacts our knowledge. So how we maybe hear other people talk about something, what they tell us about something, maybe how we read the news, that would influence our knowledge and our attitudes about a certain health issue or behavior. So in this particular example, they were looking at health behavior change related to exercise and what might influence someone to go and exercise. And so they hypothesized that things like green space, having a safe neighborhood, even having the ability to access something like a gym would be really, really important factors that would influence someone's behavior of whether or not they would go exercise. So these are the three main behavior change models. Now, when we're designing an intervention to change a behavior, which model would we use to design some program or policy or intervention in order to actually change that behavior or to understand that action? As you can imagine, it does depend on the behavior that you're talking about, and it depends, of course, on the population. So usually in the real world, you would use something like a psychology experiment. You might use a survey in order to assess which factors are actually likely to be the most influential. Because after we went through all those different types of factors, there are many, many different types. And of course, they're not going to always be equally important. Depending on the behavior, depending on the population, some of them might be more important at actually predicting whether or not someone takes an action or performs some sort of behavior change. So take something like smoking even. If you wanted to prevent smoking, you might think about it from the perspective of prices. So costs in some populations might be really the factor that's most influential at getting people to stop smoking. In other populations, in other places, maybe it's really social norms that influence smoking in the first place. And so maybe the only way that you would actually reduce smoking would be to change how people perceive smoking and change those social norms around where smoking is even permitted. So what are the potential limitations of these models? Well, of course, humans are consistently inconsistent. Unfortunately, people's intentions don't always match the behaviors that they actually take. So it can be pretty difficult to try to predict how people will react or how people will act in a given scenario, but there are certainly ways to study it that would suggest that they're likely to do certain things, they're likely to perform a certain way. But of course, there are always going to be those exceptions because people are so notoriously inconsistent. Now, I want to talk about the case study. So hopefully some of you at least did the reading for this week. I think it was an interesting one that could certainly raise a lot of interesting questions about campus culture, alcohol consumption. So to begin, let's first define what is drinking or heavy drinking, what is problematic drinking. So Statistics Canada considers problematic or heavy drinking as having 5 or more drinks for males and 4 or more drinks for females in one particular occasion, so one evening, let's say, at least once per month in a given year. So according to this, many people in their sort of younger adult stage of life, so the 18 to 34 category, tend to be the ones that really perform this action or have this sort of behavior of heavy drinking. Do you guys agree with a figure like this, or what are your thoughts? Does it surprise anybody? Anybody surprised by this or no? Sunima says, yeah, it seems right. Not really surprising. Now, I want to ask, why do you guys think it's not surprising? So what isn't surprising about this behavior, particularly in this age category? So Zoe says stress may induce unhealthy behaviors. Yeah, so certainly in the younger age category, there might be more stress, and alcohol might be a way for those people to cope. Is there anything else unique about that age category? So Sarah says a lot of social interaction in teenagers. Amber says campus culture, party culture is heavily reinforced by peers. Esme says as you get older, your hangovers get worse. Yeah, so maybe that's a incentive for people not to keep drinking later on in life. And of course, legal drinking age, says Zoe. Yeah, so certainly legal drinking age is why we don't necessarily see a high prevalence of drinking in younger age groups, although those people might also be kind of harder to capture in something like a census because they're probably not readily admitting to their parents that they're drinking regularly, for example. So that's why you actually see the E here. It says to use this particular data with caution. Abby says males heavy drinking is always higher, which is interesting. Yeah. And, a lot of that does have to do with biology. Males, of course, can tolerate usually higher quantities of alcohol. So it might not purely be based on something like their social interactions or their peer influence. It might also have to do with their biology there. But yeah, so good. I think you guys mostly kind of got the picture here that many of us are not surprised by this type of figure. Many of us know it to be true because, of course, we all went to university. We've all interacted with what goes on at universities, and maybe that kind of influences what we think about it. So I want to get to this, what is campus culture? What is that all about? So according to the reading from this week, they define campus culture as persistent patterns of norms, of values, practices, and beliefs. All of these assumptions that really shape how the behavior of individuals as well as groups in a college or university, how it influences the behavior, and how it provides a frame of reference from which to interpret the meaning of events and actions on and off campus. So all that means is that campus culture is really kind of this bubble that you can separate out from an off-campus environment. It is a very specific kind of environment that you can characterize as other than other environments. So why is this potentially problematic? Well, campus culture can make some students feel marginalized. And it can make them feel marginalized if they don't feel like they're part of that dominant group or that dominant culture, if they don't feel like they really fit in among the peers around them. It can also make some students feel stigmatized. Now, that can happen if they feel shame or if they feel embarrassed about going against group norms, maybe if they feel stigmatized for seeking supports that are disapproved of in the sort of dominant culture around them. And certainly they might feel embarrassed to seek help for certain problems if they feel like it's not something that's really popular or commonly done around other group members. So other studies have found that peer groups are a really, really important predictor of binge drinking, specifically among high school and university aged individuals. So I want to ask you guys, does campus culture differ by university? What are your thoughts on that? Amber says 100%. Yes. So Nima says, yeah, we've all heard about the party university. Yeah. So there's definitely perceptions out there of how certain universities have a different campus culture and how those cultures can certainly influence people's decisions and what kind of behaviors they have. So what did their particular study find? Well, in this study, they were comparing different campuses across Canada, and unfortunately, they didn't identify them. So we don't actually know which universities they were studying. They kept it anonymous so that I guess schools wouldn't feel stigmatized by whatever the results from the study found. But so in any case, the authors did find that students who felt that their campus atmosphere promoted alcohol, unsurprisingly, had higher alcohol misuse, specifically on residents. Students who felt that faculty cared about them tended to report less alcohol misuse. The students who felt a sense of belonging on their campus tended to have less alcohol misuse. And those that felt valued as a person on their campus seemed to have a higher willingness to seek help for substance use issues. So again, I want to turn it to you guys. You know, pre-COVID, when most of us were spending a lot more time on campus, how do you guys feel that Mac's campus culture impacted your or your peers' consumption of alcohol compared to other universities you may have visited or maybe heard about from friends? You know, what is Mac's campus culture in comparison to other places that you guys may have visited or heard of? So what are your thoughts there? You certainly don't have to share any personal experiences. You can kind of talk about this in a general sense if you prefer. Maybe those of you that lived on res might have some perspectives. So Abby says, I visited Brock and it's like a different world. Okay, what do you mean by that? How would we characterize their campus culture in comparison to Mac's? So some universities are more lenient about their rules. Amber says Mac's campus culture is very present, but not as intense as some other universities. Fiona says definitely a decent amount of drinking, but not as much as some other schools like Queen's. Interesting, okay. Anyone else have any perspectives? There's a lot more partying on residence at Mac. It wouldn't be tolerated. Interesting. Peyton says, I went to UVic for my first year. There was a lot of drinking and little to no supervision. Okay. So Sunima says, I think Mac is in between. A lot of students really value academics. Okay, interesting. So that might suggest that on Mac's campus culture, maybe it's not so much drinking that really influences decision-making so much as other important aspects of campus activities, things like studying and working and getting good grades, perhaps. Do people agree with that? Is that the experience other people have sort of witnessed or noticed? Yeah. Okay. Well, it's interesting. Yeah, everybody sort of had a similar, I think, perspective of what Mac's campus is and maybe how it compares to other places. And of course, many of us have heard stories. Certainly, you know, anytime you're applying to university, I remember at the end of my high school when I was applying to universities, you know, people are aware of what reputation certain schools have, what campus culture you maybe feel like you would fit into versus ones that you maybe want to avoid. And so a lot of that does factor into how people approach their day-to-day activities on campus and what their priorities are, what decisions that they might take on a given campus based on the culture. So why should we care about campus drinking? You know, maybe this sounds like it's not actually that important, but drinking does influence the habits that you develop later in life, particularly those who are heavy drinkers sort of before the age of 25, so young adults. It does influence your drinking patterns later on in life. And alcoholism during the younger adult stage is very different from later aged alcohol. So there's a lot of other characteristics that differ between age groups that have alcoholic issues. So, and specifically, you know, frequently the younger age group is associated with more fighting, more sort of violence when drinking. On the other hand, the older age groups tend to have more of a loss of control. So perhaps alcohol dependence is a little easier to hide when you're younger, whereas the older you get, the more trouble someone might have hiding or masking a substance use issue like that. There also is a difference about something like the feelings associated with use of alcohol. So when you're younger, it tends to be associated with, you know, feelings of freedom, feelings of fun, whereas the older you get, you know, it's much more associated with these feelings of guilt or fear or shame about alcohol dependence. Now, the reason we say this is that if there's differences in the characteristics associated with how people approach drinking, how they feel about drinking, it's going to require different management approaches. So you can't design a particular, you know, public health policy around drinking that's going to fit the mold for someone who's younger versus someone who's older. So that's why it is important to take a look at how these characteristics might differ with age groups. Another reason we should care is that the social acceptance of drinking really does make alcohol abuse and dependence really easy to miss, particularly in the younger age groups. It is something that's often touted as, you know, being cool and having fun. A lot of the events, especially on campuses, do tend to be centered around drinking and people's consumption of alcohol. Of course, alcohol advertising and social media certainly does play a role in this as well. And that does influence a lot of the social norms that we have around drinking and thinking that it's a very, you know, normal, carefree behavior, something that many of us can partake in casually, and it's, you know, not problematic to anybody. But of course, it does carry significant health risks, particularly the more that you do consume. And so a lot of people don't even realize that when we're talking about the health impacts of drinking, it does go beyond something like drunk driving, something like you know, cirrhosis of the liver. It is in fact associated with certain cancers as well as other types of diseases that maybe people are less aware of. So what could be done? How could we use some of those health models to inform better programs or policies for behavior change around campus drinking? So I just want to kind of highlight this as we end today's lecture, because the whole reason that we talk about these health behavior change models is really to develop these types of policies, or to think about ways that we can approach some decisions that maybe we want to help change, or maybe steer towards some better health promoting decisions away from health harming decisions. So remember that health belief model was all about beliefs and how beliefs are important. And so related to campus drinking, you know, maybe you would want to design a program that would look at how beliefs around drinking could change. Thinking back to that self-protective theory, you know, maybe you could think about it from the perspective of how could self-protective behaviors around drinking be encouraged? So something even like dry campus events, right? That would maybe encourage more self-protective behavior over health-harming behaviors. And then, of course, that social cognitive theory would tell us that social and environmental influences are really important. And so from this perspective, maybe you would design a policy or program that is taking that into consideration, thinking about what is the broader social environment and how would that have to change in order to encourage less drinking on campus. So I'm going to end it there. And hopefully you guys enjoyed this lecture. We're certainly going to talk about more of this tomorrow with respect to health risks and health risk perceptions, and again, how that ties into a lot of our decisions around health behaviors. So Thanks, everybody.